Hello everybody, welcome back. This is Dr. Mark DuPéré, plastic surgeon at the Visage clinic here in Toronto, beautiful Canada. Thank you for joining us. Thank you to my patient for agreeing to this filming. Today we're doing lipedema surgery. Lipedema is a somewhat new entity in Canada, but it's been around and recognized in Europe for many years. I've been treating lipedema for about 8 years now in Toronto. Lipedema is a condition that affects many women in the world where there is abnormal fat in a disproportionate amount in the lower extremities and often later on in life in the upper extremity. So the common lady will be very narrow-waisted, narrow trunk, petite shoulder, but very disproportionately larger in the lower legs and sometimes the arm. They will, as the disease progresses, will start having some pain, experiencing pain throughout the day. They may have areas of tenderness. We may be able to feel nodular fat in their tissues. When we open a tissue for a lift, for example, we do often see those nodules of fat that we try to take out. Now, this lady is in the early stage. Again, it's often genetic. We see this in their mother, their grandmother, their sisters. It's a disease that tends to be triggered with hormonal changes for our ladies. So occasionally during teenager years, more commonly with pregnancies and or menopause, there seems to be burst of kind of acceleration in the disease. Lipedema is treated with liposuction. Liposuction is a non-selective removal of fat, but we are removing a significant amount of disease and slowing down the progression over time. Now, most of my ladies coming to see me want to see their ankle and they complain about their lower legs. Now, this lower leg has just been done. We remove 1.8 liters of fat from here to here. I like to do it on their tummy, so prone position where I can access most of the lower leg. You can see now that we see her thigh, the knees narrow, the muscle part, and then the tendinous part of the lower leg with an ankle. Now she is swollen, we just did it, so there is some swelling, but you can see how much smaller this one is versus this one, where there are no ankles, there are no definition musculotendinous area. The knee, the thigh, and the lower leg is almost one piece. So we call this tubular legs, tubular lower leg and cankle. That's how patient will call it. So for ladies, obviously it's very important to have an ankle. Our ladies like to wear dress shoes and high heel shoes and skirts and dresses. So having no ankles bother a lot of our ladies. So the primary goal with lower leg for me is to give them an ankle and a nice definition between muscular and tendinous area. Now, I like to stay within 5 liter liposuction. The more liposuction we remove, the more bleeding they get, the more difficult the recovery is. So my limit here is 5 liters. I ask my patient where they want to prioritize the removal, and many patients want me to do this part nicely. This is somewhat a technically difficult part, so if somebody wants me to do this part, I do it very well. I do the back, the sides, and then when I turn her, I will do the front. The front has commonly little pockets of fat around the knee, in front of the knee, on each side, and there's also pocket of fat in front of the tibia. You can see a clear demarcation in lipedema patient, and it's one of the telltale signs of lipedema. Now, once I'm done, so I did 1.8, I will do 1.8 here, then I distribute the leftover between the outer thigh. She wanted me to remove some, so I've removed some here. We'll do inner knee, inner thigh from the front, and we'll go up to 5 liters. I do keep them overnight. It's important for rehydration, but also for anticoagulation. Because we cannot wear the pneumatic pump that pumps the blood back to the heart as we normally do in trunk or facial surgery, this lady had an anticoagulant before the surgery and she will be having more tomorrow. And then the key after this is to ambulate every hour when home. She'll need help for a few days as any of our major surgeries. Iron replacement is important, so we recommend 4 to 6 weeks 3 times a day, which will constipate patients a little bit. So you do things that make you go to the washroom. And then you continue the iron replacement until the energy level is back to normal, approximately until 2-3 weeks post-surgery. Now this lady needs 1 surgery, and I think she'll be good for many years. When lipedema is more advanced, the thigh usually requires a 2nd procedure to get to a volume that's more consistent with the upper body. And at that point, depending on age, previous pregnancies, skin laxities, we decide whether or not a skin lift is also required or not. And obviously those are discussions that we talk with the patient in consultation. Lipedema surgery is a very important component of my practice here in Toronto. We see 1 to 2 patients a week in surgery for this concern. Patients are usually very satisfied, and you